Okay, good morning to the Americas, good afternoon to Europe and Africa, and good evening to Asia and Pacific. This is a webinar organized by socialprotection.org, facilitated by socialprotection.org, and organized jointly by UN Department for Economic and Social Affairs. That's the Secretariat for UN Commission on Social Development, UN Women, which is the Secretariat for the UN Commission on Status of Women, and Transform, which is represented here by Stanfield Michelo from Zambia, and THL-Finland, managing the European Union Social Protection Systems Program, cooperating with all these partners. Next slide, please. These are the presenters. Let's take the next slide. Yes, we have decided that Dr. Shahra Razavi from UN Women will start. She's head of research and data at UN Women and lead author of the Secretary General's report for the UN Commission on Status of Women. This year, the priority theme of the UN Commission on the Status of Women, CSW as we call it, is social protection systems, public services, and sustainable infrastructure for gender equality and empowerment of women, which is very interesting because more or less the same topics are now the priority theme also for UN Commission on Social Development. Let's take you can read the bio of the participants in these slides. All participants are going to receive an email which includes this PowerPoint presentation, and you will also get a link to the audio of this recording of this webinar, and a survey which we would like you to respond to. Let's take the next slide. So the next presenter will be Amson Sibanda from UNDESA, as we call the Department of Economic and Social Affairs, and he is a lead author of the Secretary General's report to the Commission on Social Development. Let's take the next slide. And Stanfield Michelo is here representing one of the many practitioners who work day in, day out to extend social protection to that big majority of people in the world who are not yet covered by any social protection programs. Stanfield Michelo has over 20 years of experience from building a national social protection system in Zambia, and now he's sharing his experiences not only here but also as a master trainer of the African Regional Social Protection Leadership Training Program developed at the request of the African Union by African social protection experts with, in partnership with UN agencies, ILO, UNICEF, UNDP, UN Women, and Finland and Irish Aid. Let's go to the next slide, please. Next slide. Well, this is me. As you can see, we have in Finland a very large expert institute, National Institute for Health and Welfare, or Health and Social Policy, and I am now there working for a program that's co-financed by the government of Finland and European Union, DevCo, and OECD, with parallel support by German GIZ. I have a permanent job. I'm on a leave of absence here, and I have a permanent job at the Finnish Ministry for Foreign Affairs. Let's go to the next slide. So there is a way for you to send questions to the panelists. You are quite a big number of participants. I think, if I'm not mistaken, there are over 200 registered participants from all continents of the world. So we cannot take your audio questions, but we can take your questions through the chat box, which is on the right-hand side of your screen in the chat box. So please send your questions, indicate briefly who you are, your name and your organization, and please type your question and to whom you would like to address it. Let's take the next slide. So usually, okay, a very quick introduction by myself. We can take the next slide. So first, the first starting point for this webinar is that we now have a situation where the UN Commission for Social Development starting 11th of February and the UN Commission on the Status of Women starting 11th of March. Both are discussing more or less the same topics. The priority theme of the CSocD is addressing inequalities and challenges to social inclusion through fiscal, wage and social protection policies. And the priority theme for UN Commission on Status of Women is social protection systems, access to public services and sustainable infrastructure for gender equality and the empowerment of women and girls. There are excellent background reports, Secretary General's reports for both these commissions, and you can easily download them. There are small PDF icons on the right-hand side of your screen, just above the chat box. Even now or later, you can download those two reports from there, which I highly recommend. Let's go to the next slide. And here's a small picture just about the United Nations intergovernmental normative work in these two commissions. As you know, we have UN General Assembly at the highest level, and under that two councils. We have the UN Security Council and we have the UN Economic and Social Council with the high-level policy forum. But under these, under the ECOSOC, we have a number of expert commissions. One of them is the Commission on Status of Women, one is the Commission on Social Development, CSocD, and one of them is the Commission on Population and Development. There are still some others, but now we have for a long time felt that it's actually pity that these commissions, the agendas of these commissions have not been extremely well coordinated. And since some of our ministries of social affairs, for instance, often participate in the Commission on Social Development, while in some countries it's a different ministry, for instance, a Ministry of Gender, Children, Community Development that's participating in the Commission on Status of Women. And although we are all really together, we are working together, we are striving towards the same goals, we sometimes fail to work optimally together. And this is a big agenda, trying to improve the cooperation of these expert commissions under ECOSOC. This year we have a fantastic opportunity because both these two commissions are focusing on promotion of gender, social and economic equality, and social inclusion through social protection systems and other public services and other public policies. As you saw, the Secretary General's reports to the two commissions are available for download. We also encourage you to familiarize yourselves with Transform. There's a link to the Transform website on socialprotection.org. And there's also a link to the website of the EU Social Protection Systems Program at THL-Finland. We have a big number of international organizations, UN organizations, and so on, working on these questions. But somehow the question, what should we do, is dealt with in these normative commissions. And then the idea is that the operational UN agencies like UNDP or UNICEF, ILO, and so on would be the instruments that help us to reach those goals set in these commissions. So this is the whole idea. We'll first hear the presentation by Dr. Shahra Razavi of UN Women. She has an executive board meeting today and she has to leave in about half an hour's time. So she will give a presentation and there will be an opportunity for 2 or 3 questions to her. Then we'll continue with Amson Sibanda from UNDESA and Stanfield Michelo from Zambia and Transform. Shahra, the floor is yours. Welcome.
Thank you very much, Timo, and many thanks to the socialprotection.org team for having facilitated and enabled this webinar. It also gives me a pleasure to be sharing this platform with other colleagues, with Amson from UNDESA and Stanfield from the Transform team. So it's a great pleasure to be here with them. Let me begin by saying a few words about the context within which the Commission on the Status of Women with this particular theme is taking place. So I'll give you, if we can move to the first slide, some background in terms of what the conditions are within which these important policy areas are being highlighted for member states to take action on. Firstly, we know from recent data that we have been analyzing with the World Bank based on a very massive collection on household survey data, household income and consumption surveys, that women are at an elevated risk of extreme poverty compared to men. This is particularly so during their prime reproductive years, i.e. When in the age group for women between 25 and 34 years, when many women in that age group are caught in the double bind of caring for young children and also having to earn an income to sustain themselves and their families. And in that particular age group, what we see is that there are about 122 women for every 100 men who are subject to extreme poverty. So there is something that happens around those years when reproduction and production coincide that increase the risk of poverty for women. Women are also more likely, when we look at the world of work, to be working in the informal economy with little access to the raft of employment and social protection rights that are conferred on workers who have a formal labor market contract. But also, I think it's really important to highlight that within the informal economy, women often occupy the least secure and the lowest paying jobs. So the informal economy itself is very segmented and segregated. And for example, women tend to cluster in things like domestic work as domestic workers, or also very strongly as contributing family workers. This is a term the ILO uses. These are people who work on family farms and enterprises who may not be earning any income of their own. So women who are working as family workers in family farms and enterprises do not necessarily receive any income of their own. So there's no direct remuneration or income, which has implications for their access to cash, for their bargaining power within the household, and their options when if they have to sort of move out of that particular family arrangement. Now, one of the factors that drives many of the labor market disadvantages that women face is the fact that they tend to shoulder a much higher proportion of the unpaid domestic and care work that is involved in reproduction of households compared to men, and same for girls compared to boys. And the analysis that UN Women has done of time use surveys shows that nearly 75% of the unpaid care and domestic work is shouldered by women and girls, compared to about 25%, which is taken up by men and boys. And we know that this work is absolutely essential, even though it's not counted and visible, because it's absolutely essential for making people live on a day-to-day basis and for making households survive from one generation to the next. So it's work that underpins any economy. The economy would come to a halt if this work stopped being performed. And yet the costs that come with having to perform this work are disproportionately shouldered by women. And we see this in the way in which women have certain barriers when wanting to enter the labor market because of these socially ascribed responsibilities. So this is the sort of broad picture that I want to give before turning to the priority theme. So if we can move to the next slide, please. So the Commission for Status of Women 63, which is the one that Timo has been referring to, this is the theme for the Commission on Status of Women is a very rich set of issues. It highlights in particular, as Timo has already said, social protection systems, public services, and sustainable infrastructure. And I, of course, understand, as Timo rightly said, that in a much more expansive view of social protection, these elements are already included. But for us, it was also very opportune to see that they're explicitly spelled out in the priority theme on the Commission on Status of Women. And we think one of the opportunities that the CSW 63 presents is to show the importance of the interlinkages between them and how addressing one and not the others would have would reduce the synergistic impact that they can have. Whereas if they're really addressed as a system, as a social protection system with these different elements, then the impact can be amplified. So first, let me just say that tackling many of the challenges that I already kind of hinted at in the first slide, in terms of the preponderance of extreme poverty among women who have young children, women's barriers to accessing paid work, women's disproportionate share of unpaid work. Many of these challenges, we believe, require investments in gender-responsive social protection systems, public services, and sustainable infrastructure, which are elements that also are highlighted under Goal 5 of the 2030 Agenda under SDG 5.4, which is the target that wants to address the inequalities in unpaid work in particular. And addressing these three areas, we think, is critical in order to free up women's time, enhance their access to economic opportunities, and strengthen their resilience to shocks, as well as addressing the unpaid work that everyone needs in order to be able to enjoy well-being and to have social development in a very broad sense of the term. Now, while there has been some important progress in improving women's and girls' access to social protection, public services, and sustainable infrastructure, there are important gender gaps and biases within these systems that remain in place. Just to give you a few examples, for example, 41% of the world's mothers with newborn infants receive a maternity benefit. A maternity benefit that will allow them to temporarily withdraw from the labor market in order when they're pregnant, when they're advanced in their pregnancy, and also in the immediate period after giving birth. So with only 41% having access to any kind of cash that could replace their paid work, this obviously has negative implications for their own health as well as for child development. And the coverage is very uneven across regions. And for example, in sub-Saharan Africa, the coverage rate is as low as 16% of women who have newborns having access to paid maternity leave. Or to give another example, the global gender gap in access to old age pensions is also globally is around 11 percentage point difference between men and women. Also, non-contributory social protections, such as universal social pensions, can play, we know, an important role in closing these gender gaps. And we have experiences from around the world where the extension of social pensions, which are non-contributory, has helped to close the gender gaps in access to pensions. However, there are concerns that benefit levels are often very low in social assistance pensions, or social pensions, as they're more often called. And not sufficient to allow women and their families to be lifted out of poverty. And even where women are covered extensively, as they are, for example, in the European Union, they do continue to face disadvantages vis-à-vis men. So in the European Union, for example, women's pensions are on average about 36.6% lower than men's. And very often this reflects men's and women's different labor market trajectories, which has implications particularly through contributory systems. Gender responsive public services also are critical and play a central role in reducing poverty and enhancing and poverty and inequality, reducing poverty and inequality, and advancing the rights of women and girls. So really, really important role for public services, public health services, education services, but also very importantly, we want to emphasize the role of care services, in particular early childhood education and care services. Now, when these public services, but again, we have to pay attention to many of the barriers that everyone faces and some barriers that women in particular face. Now, when public services are delivered through private sector, private for-profit providers, then it remains very much the duty of the state to make sure that they are affordable and that they meet quality standards. And in particular, in the context of, private for-profit and private and as well as non-for-profit actors coming in and delivering services, while that may be an option that countries want to pursue, but it really does fall on the shoulders of governments to make sure that the services are affordable for everyone, whether it's through provision of subsidies or vouchers or other means. And for some areas that are marginalized and where the private provision may not even go there, then really it is the duty of governments to deliver those particular services. And we want to emphasize in particular the greater investments in affordable child and long-term care services can be very effective. We have evidence to show, and we cited in the report, that it can have a very positive impact on women's employment options in closing the big gender gaps in labor force participation, while also providing quality care services for those who need them, children, elderly people, and so forth. And finally, greater efforts are needed to mainstream gender into sustainable infrastructure. And we know that where infrastructure such as access to clean energy or safe drinking water is lacking, women and girls have to spend a disproportionate number of hours collecting fuel and collecting firewood and water, which really compromises their health, physical and mental health, their safety sometimes as well. And it takes up valuable time that they could have invested in schooling, in training, in doing paid work, or in having rest and recuperation and self-care, which is often also very important. So having investments in water and sanitation is critical. And also we know that, investments in transport systems, for example, also are rarely planned with women's safety and mobility in mind, and that this can play a very important role in reducing the unpaid care work, as well as in increasing women's access to paid work and economic opportunities. So moving on to the next slide. We thought, we really do want to emphasize that there are important synergies that can be harnessed if there is greater coordination among the three areas that are highlighted in the priority theme report. And and in particular between social protection transfers and public services and infrastructure. We really do need to emphasize that as important as social protection transfers and cash transfers are, on their own, they cannot have the kind of transformative and synergistic impacts that can be had if investments in social protection are paralleled and made in tandem with investments in infrastructure and public services. To take a very concrete example, as you know, many cash transfers have conditionalities that for those who receive them to, for example, go and take children for health checks, or for women to go to health services, or for children to attend school. And if these conditionalities are not performed, sometimes people are excluded from that particular social protection instrument, the transfer. But at the same time, without adequate investment in water and sanitation, adequate investment in health services, and adequate investment in educational services, what can happen is that, you know, women who are incentivized to go and children who are incentivized to go to these services just crowd into services that are of suboptimal quality, and may not, the poor quality of facilities can be a real hindrance to the real kind of development and child development that is the desired outcome of these programs. And also women may end up spending a lot of time just going and getting the checks done in centers that cannot provide the service, and they may be spending, you know, long number of hours walking, for example, to schools and health posts when there isn't adequate transport facilities available. There's some very good ethnographic literature from Latin America in particular that shows some of these problems with cash transfers that have these conditionalities. And parallel investments in services and infrastructure can kind of bring out some of these synergies that are the intended outcomes of these programs. So I think this is a really important theme to take away from the Secretary General's report to the Commission on Status of Women. Also, in particular, we know that many women and girls and men and boys face intersecting forms of discrimination and inequality. Across countries, those from poor households and rural areas, and in different countries, you know, particular ethnic groups experience clustered forms of deprivation, from lower access to education to, for example, not having access to decent housing or clean energy or water and sanitation. We know, for example, from data that is available and presented in the report, that rural women's access to skilled birth attendance is 20 percentage points lower than urban women's. And also poor women's access, for example, to modern contraception is again something like 19 percentage points lower than richer women. So these class and other kinds of inequalities really reinforce gender inequalities and also put particular groups of women in very clustered forms of deprivation that are difficult to break. And it's important that these systems pay particular attention to those who are subject to these intersecting forms of inequality. Another important theme to take away is that investments in public services and sustainable infrastructure provide opportunities for advancing gender equality in employment as well. Investments in public services and in care services in particular can be an engine for employment generation, particularly if these jobs in care services are decent jobs. This can become a really important energy for and engine for employment generation. The ILO report on the care economy that has just was launched in 2018 provides really excellent evidence of how this can be done, and the significant number of jobs that can be created through investments in care services and health services to meet the needs, but also to create jobs. And very importantly, we would also emphasize that it's not just care jobs that need to be inclusive of women, and they often are, but also jobs in infrastructure that need to be also a space not only for men, but also for women. And so we need to really think about how these labor market segregations can be reduced so that more men move into care sectors and more women move into, for example, infrastructure. And finally, let me move to my final slide, and I won't go on too much about the issue of financing because it's dealt with in much more extensively in the Secretary General's report to the Commission on Social Development that will be presented in a minute. But I do want to say that obviously, the finance has a critical role to play in enabling all these investments. And we do emphasize in the report that these are investments and not just consumption, as macroeconomists think about these kind of expenditures. These are investments in the same way that investing in a bridge or a dam is an investment. You invest in your social infrastructure. This is not money that is spent and gone. This is money that has over in the short and in the medium and long term a lot of economic and social payoff. So this is how even macroeconomists need to start thinking about this. To put these investments in social infrastructure as important as investment in physical infrastructure. And to say that in virtually all countries, there is some scope for increasing investments and expanding social protections and public services and sustainable infrastructure, and to avoid the kind of cutbacks that happen in contexts of austerity, which unfortunately is a context that is not just exclusive to Europe, but is a global issue. We need progressive taxation on income and wealth, as the Secretary General report for the Commission on Social Development also emphasizes, in order to enable domestic resource mobilization. But domestic resource mobilization needs to be buttressed and supported by a kind of enabling international sort of financial architecture that really cuts and stops the outflow of finance through illicit financial flows and tax evasion, which is really robbing all countries, but in particular developing countries, of much needed finance for these kind of investments. And we need transparency and accountability in order to make sure that resources that are mobilized are actually being invested where they're most needed. So I'm done, and I'll stop here, and thank you very much.
Wonderful. Thank you so much, Shahra. We'll go straight to questions. There is one question here in the chat box from Vince Chipatuka from Zambia, from Friedrich Ebert Stiftung. There. Hi, Vince. Nice to have you with us. And the question goes, what should be the departure point in ensuring gender equality programming in Zambia, in ensuring that paid and unpaid care work is included in the social and economic policy discourse? This is to you, Shahra. And others, you're welcome to ask questions if you have them for Shahra, who has to leave in 10 minutes time.
I mean, I think this is a very good question. Thank you very much for raising the importance of the different kinds of work. I think we really need to start about, what is the purpose of social and economic policy? Social and economic policy have as their purpose, one of their ultimate aims is to enhance capabilities. If we believe in kind of the moving and new discussion around poverty and inequality. We don't want growth just for the purpose of growth. GDP on its own is a very limited measure of what the aims of any economic and social policy should be. So if we see capabilities and well-being as an important part of what any economy and society wants to achieve, I think we would only be seeing sort of the tip of the iceberg if we look at paid work, because a lot of valuable work that is done to create well-being and to create social development, which is what is, as I said, kind of the foundation of all economies, is unpaid work. And I think this can be made very clear if we show the amount of time that is invested in it, and if we show that what we measure as GDP as income. Income doesn't on its own satisfy needs. Income has to be, transformed into food items. People have to be cared for. And a lot of this work goes on in a very invisible way, but is absolutely essential for household well-being and for sustainability of any economy and society. And if we look at work in this expanded sense of the term, and I think it would be important to bring into the picture the data that is available from time use surveys to show the amount of time that goes into household reproduction, then we need to pay attention to things that are enabling of that kind of work, things that help that kind of work be carried out, and show the limitations when there are constraints and people have to cut back on those on that kind of work. So I think a good starting point would be to point to the way in which paid and unpaid work together create the services, if you like, and the goods that are necessary for households and for children and for adults to live and sustain themselves. And now I think with the availability of time use surveys, it's possible to quantify that. And we can also show what happens when that kind of work has to be cut back. It has negative implications in terms of children's well-being. When people are overstretched, it has negative implications for their own health and well-being. And there is, very good research to show some of the costs of that happens when those kinds of work have to be cut back, whether it's in terms of girls not being able to go to school, or whether it's in terms of health implications. So I think that's an important starting point.
Thank you. There's another question from Zoneb Khan from University of Johannesburg. Hi, I wanted to ask Professor Razavi if she had any ideas about how existing child-centered social assistance in the developing world could be tweaked to incentivize greater male involvement in unpaid care.
That's a really good question, and I must say there isn't a lot of evidence that has shown how. First of all, let me just see. Your question is not necessarily about having more men do the paid care work, be childcare minders and workers in these centers, which is also a challenge. Even a country like Norway that tried to bring more men into these childcare centers and into care jobs found it very difficult to do that. So that is a challenge for many countries. But how to get more men to be involved in, for example, bringing children to the centers, I think this is something that I cannot speak of any experiences that has shown how this can be done. There are ideas around how these centers need to make it change the social norms around who actually does the care work and who is welcome to bring the children to the center, by making sure that sort of maternalist ideas are not reinforced in the way in which centers assume that it's always mothers who bring children to the centers. There has been, some arguments about whether location of centers can make a difference. If the childcare centers are located more in places where jobs are, particularly where men may be going, this can be an incentive for men to be at least bringing children to the centers in the morning when they go to work. But I really have to say there isn't much evidence that I can tell you of how to do this. It's at a very preliminary stage. And there isn't much in terms of evidence on how to do this. So I'm afraid I cannot answer with any good examples or best practices of how it's to be done, but it's a challenge and it's something that we all need to be thinking about.
Thank you. There's a third question, which is in your presentation, you had this one bullet on saying that investments in public services and sustainable infrastructure provide opportunities for advancing gender equality in employment, in brackets, care, jobs. So could you elaborate a bit more how the rationale here from fragmented employment careers of women to pay gaps and pension gaps, and what then potentially and time poverty, and what then potentially the formalization of care work could do to change the situation for those who engage in care work and for those who no longer need to engage so much in care work at home.
Yeah, this is one area where there has been more work recently, and including in developing countries. I think we did a kind of simulation exercise with Uruguay and South Africa, to show that if early childhood education and care services were to be universally available through the public system, and we showed how that could increase female employment. In South Africa, there was a significant increase in female labor force participation. I cannot remember the exact, I think it was by almost 11 percentage point increase. And what also we showed was that if there is an expansion of these services through the public investment and public services, and the jobs that are created, the way we did the simulation, we assumed that they would be formal sector jobs and the pay would be at the level of, primary school teachers. So it built those assumptions into it. Something like 40% of the initial capital investment could be recuperated through the tax and transfer system, because once you had these people who were employed, formally employed, then they would be paying taxes, and it would also reduce the amount of social assistance that they would receive. So that's what the simulation kind of tried to capture. And as I said, about 40% in South Africa of the cost of the initial investment would be recuperated through the cash, through the tax and transfer system. And the outcome would be an expansion of formal sector employment in the care sector. And by implication, this would be a strategy for formalizing labor, because the jobs that are created in the care sector would be within the formal economy. So it's part of what ILO is talking about, formalizing the informal. And it would mean that those people who get these jobs would have access to a contributory pension, would have access to other kinds of social protection that comes through a formal labor market contract. So in a way, as we have said, it's a strategy that really hits three goals at the same time. You are at the same time reducing the amount of unpaid care work that women do when you have reliable quality childcare centers. So women can leave the children, families can leave the children in a safe place. It can increase women's employment through that channel, the labor supply, if you like, channel. It can be good for children's own child development if there's quality care provided, so children are more school ready, so it hits the child development goal. And at the same time, it can also create jobs through the labor demand side, if you like, because very often the question is not only women don't have time, it's also that there are not many jobs in the economy. The economy is not producing enough jobs. So if you do a boost through the care sector, you not only reduce unpaid care and increase the supply of women's labor, you can also create demand for female labor through the care sector. And I, just to say, historically, this is how the Nordic countries created jobs for women and created their welfare state. So there is some historical traction to it as well. And there has been considerable amount of work also on developing countries. The UN Women case study I mentioned on Uruguay and South Africa is in our SDG report that was launched in February, Turning Promises into Action. So please go to our report, Turning Promises into Action, and you can see the simulation exercise we did with the numbers. And ITUC has also been doing similar exercises for the high income countries, showing how investment in the care economy can be a job creating, formal job creation engine for many economies.
Thank you so much, Shahra. We'll have to stop now, otherwise you'll be late from the Executive Board meeting. Thank you so much. There were a couple of other questions in the chat box. You will be receiving them, and for those, Armi Korhonen and Jacques Conforti, Shahra Razavi will be receiving your questions. They are relatively broad, so here we might not have enough time to cover them properly, but Shahra will promise to try to communicate with you on those.
Yes,
so thank you very much, Shahra.
Yeah, I'll do that.
Good luck for the preparations. Meet you at CSocD and then again at CSW.
Yeah, and I'm sorry that I have to leave, but I have read quite carefully the report that Amson will be presenting, and it's a great report, and I want to congratulate them. And there's, I think, a lot of room for cross-fertilization. So I hope in the discussion you will be pointing to the ways in which our different reports connect, as well as having some differences, but they do connect on many important points. Thank you very much, and good luck and goodbye.
We'll move forward. Amson, you could click on your camera icon and your microphone, and Karin in socialprotection.org. Can we move to the next slide? So Amson Sibanda from UN Department for Economic and Social Affairs will start. Welcome, the floor is yours.
Thank you, Timo, and thanks to everyone who is listening. My task is quite simple. Basically, is to give you a flavor of the report of the Secretary General that we prepared for the priority theme for the Commission for Social Development, which will be held on February 11. So I'll try to give you some background to the topic that was selected, and then what are the issues that we try to highlight in the report. So during last year's discussion, member states decided to focus on SDG 10, in particular to focus on target 10.4. If you can go to the next slide, please. So they decided to focus on reducing inequality within and among countries. And in particular, they wanted to zero in on one specific target, and this was target 10.4. So the SDGs report basically focuses on fiscal, wage, and social protection policies with the hope of addressing inequalities and challenges to social inclusion. Next slide. So what are the key messages in the SDGs report? Basically, we start off by discussing some of the major trends that we see when it comes to inequalities. One of the main issues that we try to highlight in the report is that income inequality is harmful for the pace and sustainability of growth. It also undermines the productivity and dynamism of the economy, since it leads to suboptimal investments in things like education and health. We also have evidence from various parts of the world that inequality does lead to diminished intergenerational social mobility. More importantly, in the case of developing countries, high or rising inequality does reduce the impact of growth on poverty reduction. And we have also seen in certain parts of the world that inequality tends to lead to social tensions. And of course, we all know about the cases in the Middle East and North Africa where the Arab Spring is to some extent linked to issues of inequality. Next slide, please. So in terms of what we know with regard to trends in income inequality, and most of these key starlight facts, I think, come from the 2018 World Inequality Report that came out of colleagues in Paris. So basically, global inequality remains high, although it has seen some decline in the recent past. In particular, when you look at income inequality, we have also seen that it has been falling since 1990. However, when you look at average within country inequality, this has been rising in many regions of the world. In particular, income inequality has increased in almost all regions since 1980, and this is a very worrisome trend. Next slide. And of course, we also see that between 1980 and 2016, the richest 1% of the world's population captured 27% of all the income growth that occurred. While if you look at wealth inequality, we also see the same patterns, with the top 1% capturing almost 33% of all global wealth in 2016, as compared to 28% in 1980. Obviously, such concentration of income or wealth, coupled with the impacts of globalization, rapid technological change, and other forces, has led to economic anxiety in many places. It has led to alienation, and of course, it has contributed to the decline in trust in governments and in public institutions. So when the Commission decided to focus on inequality issues, the key question is, how can policymakers respond to these challenges? And I think two key messages resonate throughout what we try to underscore. The first message is that policies do matter. And secondly, institutions do matter if you're trying to address issues of inequality and fostering social inclusion through policies such as wages or fiscal policies or social protection policies. Next slide. Focusing on the first set should be fiscal policies, or you went to wage policies? Okay, I think we skipped one slide. Did we skip a slide on fiscal policies or no? No, you have to go up. Okay, I think we skipped that one. Okay, that's fine. So in terms of wage policies, I think wage policies are critical to addressing inequality and to promoting social inclusion in many ways. But for wage policies to be effective, it means that we have, or countries have to implement the decent work agenda in its entirety. We're reducing inequality and promoting decent work for all women and men. We all know that these have been identified in the 2030 agenda as critical. And of course, issues of wage growth and wage inequality are very, very important. What we have seen in the recent past is that the global economy has recovered, but obviously wage growth has not caught up to the recovery that we have seen. So wages basically are the missing link to the recovery that we are seeing, in particular decent wage growth. So we need to focus on basically achieving equal pay for work of equal value, as my colleague from UN Women has tried to underscore, without, I think, addressing the issue of the gender disparities when it comes to wages. It is very, very difficult for societies to achieve gender equality or to address social inclusion or to tackle inequality. And then, of course, when we talk of inequality, the larger it is, and of course, the larger the gap in inequalities of opportunity, this is much harder to achieve the decent work agenda. So we need basically to make sure that we narrow income gaps as well as opportunity gaps if we are to make progress in the 2030 agenda. Next slide. Of course, one critical element that always comes up when we talk of wages is the role of the minimum wage and, of course, collective bargaining. In some countries, we have seen an attack on minimum wages as well as in collective bargaining agreements. Minimum wages, some argue, if you raise minimum wages, it tends to lead to higher levels of unemployment, particularly among the lower skilled workers. But obviously, we have seen that a larger proportion of evidence does indicate that raising minimum wages has no impact on employment levels. Actually, it tends to encourage more people to come into the workforce instead of people waiting on the sidelines and trying to receive social security benefits or welfare benefits. And obviously, if we also ensure that there are collective bargaining arrangements, this allows workers to share fair income from the rise in productivity that we are seeing all around the world. So when you have well-designed and effective minimum wages, this can contribute to wage growth and inequality reduction. And of course, what is critical here is making sure that countries implement ILO standards that pretty much try to promote the decent work agenda, including the issues of minimum wages and collective bargaining. And of course, the second element with regard to wages is reducing the gender wage gap. As we speak today, the gender pay gap stands at about 20% globally. This is unacceptably high, and it needs to be tackled. It's pretty much found in every society, developed or developing. And it is one of the greatest manifestations of social injustice that we continue to see. So greater efforts are required by all countries to try and understand better what lies behind gender pay gaps. Of course, my colleague from UN Women did try to articulate some of the reasons why. But of course, we need to make sure that we accelerate progress towards achieving gender pay equality. Next slide.
We'll go now back to the fiscal policy slide, which was skipped.
Okay. Yes. So, and then of course, for countries to make progress, I think it's very important to zero in on how governments collect resources and how they spend those public resources. So fiscal policies are very powerful tools that government can use to influence both the economy and social well-being. They can contribute to reducing inequality and to fostering social inclusion if they are consciously targeted towards restructuring economies to make sure that they generate sufficient decent work for those people who are out there who want jobs. Of course, they can make systematic investments in high quality human development, particularly focusing on education and health investments. Of course, they can also ensure that issues of equity and sustainability are key guiding principles. And of course, it is very important that when we come up with fiscal policies, both taxation and public spending needs to be coordinated. We cannot take a piecemeal approach to addressing issues of taxation and then look at public spending differently. But we need to look at these things in a holistic fashion. Next slide. Yes. So the third element that we highlight in the SDGs report is the role of social protection, which is the theme of this webinar. Obviously, the report does underscore that social protection and achieving universal coverage, these are key policy accelerators. Social protection can contribute through an integrated cross-sectional approach to unleash rapid progress across different SDGs. So I think the key word is making sure that we have an integrated cross-sectional approach when we're looking at the implementation of social protection policies or when we're trying to scale up social protection programs. So they do connect both the economic and social dimensions, but as well as the environmental dimensions, which constitute the 2030 agenda. And of course, we have been pushing, ILO in particular has been pushing for the establishment of social protection floors. These are very efficient ways to reduce vulnerability and to strengthen resilience to natural disasters and other shocks, as well as combating poverty and inequality and social exclusion. But of course, despite their recognition, we still have 4 billion people living without social protection at all. And of these 4 billion, 1.3 billion are children, which is a very, very high number. So there is a continued need to close coverage gaps by extending social protection based on ILO recommendation 202, which concerns social protection flows. Next slide. And of course, countries should, so the main recommendations that we try to focus on in the report, of course, there are several recommendations given that the topics that the report covers are many, and 3 in particular. So we try to make sure that we could zero in on a set of recommendations that can take us forward. I think one of the key ones is that countries should enhance the role of fiscal policies on inequalities of opportunity and outcomes and promote social inclusion. And they can do this by expanding and sustaining fiscal space. Of course, this requires raising revenues rather than cutting productive social expenditures, especially those targeting health and education expenditures. It also means improving tax fairness, reducing the informal economy, increasing tax progressivity, rationalizing tax exemptions, and of course, trying to address issues of tax evasion and illicit financial flows. And to simultaneously address inequality and poverty, it is important that governments consistently pursue counter-cyclical fiscal policies by expanding fiscal space and strengthening automatic stabilizers. I think this is one key lesson that we learned given following the 2008 global financial and economic crisis. Those countries that did pursue counter-fiscal policies did fairly well in minimizing the damaging effects of the crisis on things like employment and poverty. And of course, it's very, very important that governments also carefully assess austerity-based fiscal consolidations. There's tons of evidence that shows that austerity-based fiscal consolidations have harmful effects on inequality, poverty, and social inclusion. They tend to raise poverty, they tend to worsen inequality, and they tend to worsen social inclusion or social exclusion. Next slide. Coming to labor, wage policies, the SGS report does underscore that labor market policies should strengthen institutions that provide adequate labor protection to all workers. And of course, countries should implement policies that support female labor force participation, promote equal pay for work of equal value, and embed gender equality in all policymaking. And policymakers should also pay particular attention to addressing the disadvantages that women, youth, older workers, persons with disabilities, migrant workers, and temporary and part-time workers face in employment. Some of these groups do not benefit from social benefits that are provided at the workplace simply because of the nature of their contracts, especially when they're temporary workers or part-time workers or when they're young workers. And of course, countries should also build national social protection systems, including floors that cover all people throughout the life cycle. I think this is a very, very important fact. We cannot just do social protection that covers individuals during a particular stage in their lives, because the chances that they can be exposed to certain shocks, that exposure extends throughout the life cycle. So social protection coverage should protect people throughout. And of course, countries should also better coordinate social protection flows and measures with poverty eradication programs and universal social policies to avoid excluding people in informal or precarious jobs. I think in many developing countries, people who are in the informal economy or who are in precarious employment tend to be excluded when it comes to social policies or social protection policies.
Thank you very, very much, Amson. This really gives us the big picture of some of the central policies that governments can make and how they link to social protection and also to gender equality. I think it would be best for us to take next Stanfield Michelo's presentation, because I think the questions may go equally well to him as well as to Amson. We had a question from Valentina Barca, but I'm sure she's interested in hearing Stanfield's presentation, and the question can then be addressed to both Amson and Stanfield. So Stanfield, welcome. The floor is yours. Stanfield, please unmute your microphone.
Sorry, thank you so much. Good morning, good afternoon, good evening. I hope now you are able to get me. It's a pleasure to share this platform with the other panelists. For me, my discussion centers around the cash transfer and also the Spire Work program and also the transform. So I'll be sharing basically the experience about Zambia. Next slide. So when you look at Zambia, the key message from this particular slide is to say the poverty levels are still very high, and they've been pervasive for a long period. From about 1991 up to 2015, you can see that the graph has not shown a significant reduction. Poverty continues showing a rural face, and also when you look at urban poverty, it's at 23%. Next slide. So one of the greatest challenges we are facing are the high inequalities. And when you look at Zambia, the inequalities are at 0.57, which is higher than the average Gini coefficient, which you get at 0.43 on the continent. So for me, the inability to distribute this economic growth fairly across the population could be termed as an indictment, because probably we have not worked hard enough to ensure that everyone is able to benefit from the benefits of the economic growth. Next slide. So why do we want to reduce poverty and inequalities in line with the theme of the upcoming meeting at the UN? Everyone does agree that human rights and justice deal with the issues of poverty and inequality. And Mr. Sibanda has already mentioned to say we need to reduce inequality so that we're able to give impetus to economic growth. And also, if inequalities are not addressed, they can be a recipe for conflicts. And also, we have seen in some areas that when poverty levels are very high, they tend to be a negative factor in terms of the sustainability of the environment. And how does inequality manifest itself? It could be a question where Grace is able to say, now I want to go to Oxford University, and whereas another child in another country, Mary, would say, I want to go and sell at the market because this is the only lifeline that my house or my household has. So inequality tends to manifest itself in different ways. Next slide. Next slide. So when you are looking at Zambia, the first program in terms of social cash transfer was a pilot program, which was implemented in starting from 2003. And at the time when the concept was brought up, there was a lot of pushback from a number of stakeholders because the concept at that time was very new. I still remember to say one of the strategies we had to employ was to say we needed to find an entry point, and therefore the ultra poor were used as an entry point. And at that time, it was decided that we should target only the so-called bottom 10% using the community-based targeting system. So this picture depicts one of the first beneficiaries of the social cash transfer in Zambia in 2003. I remember having discussions with Treasury about the social cash transfer, and basically we were being taught to say it was not a very good policy option. I think one of the things that made it very difficult for us to sell the concept was that at that time we didn't have robust data from the country which we could use to project to the Ministry of Finance, because they were saying there were people who believed in figures, and at that time, because we had no research that was done, we didn't have robust figures. So emotions could not basically be able to tilt the thinking of the economists at that particular time. Next slide. So when you look at the evolution from 2003, you could see that the cash transfer has been growing, and such that as we are talking now, all the districts in the country are covered, and the program is now reaching 556,000 households. Next slide. Next slide. Next slide. So the social cash transfer is able to deal with inequality in the 4 domains of 1, poverty reduction, 2, economic inequalities, knowledge inequalities, and also social inequality. This applies at both the horizontal level of inequalities and also the vertical level of inequalities. Next slide. So in order to build the evidence, Zambia decided to implement the Zambia Child Grant Program and subjected it to a robust research. This particular program was giving $12 US per month to any household that had a child who was under 5. And the whole idea in terms of specific objectives was to supplement and do not replace the household income, and also to ensure that the number of meals the households were having were increased from 1 to possibly 2 or even 3, and also to increase the school attendance. Next slide. So in terms of the design of the impact evaluation that was done, the design looked at 90 catchment areas, which are known as community welfare assistance committees in 3 districts, covering 2,500 households, of which half were in the treatment group and another half, 1,250, was in the control group. So this was a randomized control trial using the double difference, meaning being able to compare between the treatment group and also the control group, and also comparing the baseline and also the subsequent follow-up surveys. Next slide. So in terms of results, these graphs are showing us what happened between 2010 and 2012. So when we focus on the graph on 2012, we're able to see that the blue line had shifted. And this blue line, this represents the treatment group. In short, we are able to see that a number of households were able now to cross actually the poverty line. And we also saw an increased number of households moving from the lower level and coming closer to the poverty line, meaning the poverty gap had also reduced. Next slide. In terms of a summary, in terms of the impacts on severe poverty, we saw that the poverty head count, there was a reduction by 5.4 percentage points. And then in terms of the poverty gap, we're talking about 24 percentage points. And then the squared poverty gap, it was 36 percentage points. Next slide. Then in terms of school attendance, education is very important because it's an equalizer that actually helps to ensure that even children coming from disadvantaged households are given a shot at life. So we're able to see amongst children between 11 and 14 years, their enrollment went up by 5.6 percentage points. Next slide. Then impacts on food security. Again, here we saw a positive movements between when you compare the control group and also the treatment groups. For instance, those households that were having more than 1 meal a day, there was an increase by 8 percentage points. And also for those households that considered themselves that they were better off in terms of self-assessment, they were saying 45% of those households were saying they were better off than they were 12 months ago. Next slide. Then in terms of the impacts on the community, we are able to see that one kwacha that was injected in the community, there was an economic multiplier effect of 1.79, meaning 1 kwacha or $1 was able to give us an additional amount of 79 ingwe, which is a very good return on investment. Next slide. Then the next innovative program I want to talk about is the capacity building effort that we are working with at the University of Zambia. I think everyone would agree that domestic capacity development is very important for sustainability of social protection systems. What has been happening in Zambia, I think, for a long time is that only those people that have had the opportunity maybe to go outside the country are the ones maybe that have received systematic training in social protection. But this system, I think, has only favored a few who have had those opportunities, and as a result, whereby they had a situation whereby training in social protection has not been systematic enough, and we do not have enough people that are there to design and implement social protection system. So working with the University of Zambia and also other partners like the European Union SPSS, a project has been conceived to design different educational programs, that is at master's level and also at bachelor's degree level. Next slide. So in developing these 2 degree programs in social protection and in social policy, an assessment was done within the University of Zambia, where actually it was discovered to say there were a lot of courses that were being offered in different departments and schools. For instance, within the Department of Economics and also departments of education that had the components that were relating to social protection. Then also a fair assessment in the industry was able to reveal the gaps in terms of what the employers in government NGOs that were employing staff under the social protection field they thought were missing. So based on this assessment, ideas began now to be consolidated to say, yes, the University of Zambia needed to develop a package at a bachelor's degree level and master's degree level so that we could meet the demand and the requirements of the industry. Therefore, a team was put in place, and this team was able to share ideas with other academic institutions in, for instance, University of Bonn and also universities in Finland. We even had opportunities where the Zambian team were able to visit Finland. We also had professors from Finland coming to Zambia. Once this was done, then a course outline, a detailed course outline was developed, and then a draft, also detailed modules have been done. That's the stage at which we are. Next slide. So looking at these 2 courses, the course, the bachelor's degree in social policy, basically aims at offering a background in social policy knowledge so that the participants or the beneficiaries of this particular course are able to deal with intractable social problems such as inequality and poverty. And some of the key courses under the bachelor's degree include Introduction to Social Policy, Social Risk Analysis, Research Methods, SP Administration, and also Design of SP Systems and M&E. Then when you look at the Masters in Social Protection, the aim of this particular master's degree program is to provide advanced knowledge and skills in the administration, design, and implementation of innovative social protection systems. And the key courses that are anchoring this particular master's degree program include social protection systems, advanced research methods, social protection management, MIS, social protection reforms, and the thesis. And this master's degree program has a structure that, apart from coursework, there is also a practicum where the students will be placed in the industry, and also they are expected to do a thesis. Next slide. Then the third part I wanted to talk about is the transform curriculum. This is basically a large-scale capacity building initiative that offers, I would say, in-service training to practitioners of social protection from different countries on the continent. Next slide. So this particular initiative was touted by the African Union, who saw the need that there was a need to come up with an innovative package that would be able to provide key information and learning in terms of the implementation and design of social protection systems across the country. Next slide. So this particular transform innovative package, this is a multi-agency collaborative platform involving the UN system, such as ILO, UNICEF, UNDP, and then we're also talking about the Irish Aid. We're also talking about the EU social protection systems. We're also talking about the government of Finland, and then in partnership with the other organizations such as the social protection, UNDP, and also the various experts in social protection on the continent. Next slide. So why the transform? It has been observed that normally there is always a tension between the ideal and what happens on the ground. So how do we cover up the gap? So this gap basically is the implementation gap between what you want to achieve and what is actually achieved on the ground. And the transform package is there to try to see to what extent it can ensure that this gap is sorted out. Next slide. So the transform, its methodology is such that it's based on experiential learning, whereby the methodology is anchored on ensuring that the participants are active and not passive to what most of us are adapted. And when you are using the experiential methodology, there's a lot of involvement. There's a lot of use of different activities, scenarios, exercise to ensure that the knowledge actually tends to come out from the participants. And in that way, that knowledge becomes more helpful than a situation whereby you are using the lecture method. And what we want to see is a mind shift change, a shift in paradigms, so that when the participants of the transform modules are able to go and actually make things happen in their places of work. Next slide. So far, what has transform been able to do? When you look at the actual implementation, it has been in terms of trainings, basically it has just been there for the past 14 or 15 months. And in the last 15 months, this is what has happened. Next slide. We have been able to train about 22 master trainers from the continent. So this picture is showing the dedicated master trainers that we have for the transform program. So they are coming from different countries, such as Ethiopia, there's Zambia, Malawi, and Kenya, a lot of countries. Yeah, the French speaking and are not yet part of this group because of the language, but it's something that is being developed along that way. For the Portuguese speaking countries, training of trainers was held some 4 weeks ago. So we are also going into the Portuguese speaking countries. Next slide. The trainings done so far, we have been to countries like Zambia, where we trained the civil society and also officers at the district level. We have been to Ethiopia, we trained the officers at the district level. Then we've also been to Kenya, we've been to Tanzania, covering both the mainland and also the island of Zanzibar. Malawi, we are able to offer the training to civil society, and also district officers were given an opportunity to be trained in the monitoring and the evaluation module. I think last month there was a team that went to Sudan.
Please, sorry to interrupt, but you have only 1 more minute or so to go, so please move to the last topic.
Okay, I was looking at the timer. I'm timing myself. Next slide. Then we have also been able to have a version of the e-learning transform, which is a 10-week course, and we've been able to train about 60 participants so far from almost all the continents. Next slide. Then the last initiative that I wanted to talk about is the SPIRE work, which is social protection for informal and rural economy workers. And this is a strategic partnership between Zambia and also Finland and also ILO. Next slide. Next slide. Next slide. Yeah, so an assessment that was done, we're able to see that workers in the informal sector, like domestic workers, small-scale workers, don't have access to contributory social protection. And therefore, SPIRE work was designed to look at farmers and the farm workers as the beginning point. Next slide.
Excuse me, Stanfield, I would suggest that we stop here, and I'm very sorry about it, but maybe in terms of conclusion to this, because we have 1 more minute for the webinar only to go, we encourage all participants to go and see the presentation, which will be emailed to you, also the slides that we didn't have time to go through now. Next week in Geneva, a big number of international cooperation partners and government representatives from all regions will be convening to discuss universal social protection from the normative and operational side. Then the week after that, governments will come and discuss these same topics at the UN in the Commission for Social Development. And 1 month after that, there will be this UN Commission on Status of Women, where also social protection systems is a key part of the priority topic. There were questions from Una Morey and Younes Sharkbo, which will be shared with the presenters. Actually, now I received a message from the organizers that we can extend the session by 10 minutes, but not more than that. So I think I would encourage now that Stanfield, if you agree, that we would ask the participants to place their questions while they are doing that. If there was something extremely important you still wanted to mention from your remaining slides, please do. But while you do that, please also think of the question that we got from Una Morey, our colleague from Irish Aid. Do you have a way to translate these recommendations so that they can resonate with the business community? And this same Amson would be welcome to respond to this as well. And sorry about the running short of time, but we still have some 10 more minutes to discuss. Stanfield.
Yes, the slide I'm interested in, I think, let's go to the next one. Yes, yeah, this is the slide I wanted to share. So having identified the farmers to say as the first beginning point to address issues of ensuring that they start contributing towards their social protection, a benefit package has been proposed. And this benefit package, one, there is long-term benefits and short-term benefits. So in terms of long-term benefits, we are talking about issues of old age. When somebody is unable to work, we want them to be able to benefit from social protection. There is also invalidity benefits and also survivorship in the event that the breadwinner dies, what happens to the children. And then for the short-term benefits, we are talking about maternity and also funeral benefits in case somebody was to die early. And also there's been a proposal to say we should be able to have a mix of incentives so that the informal workers will be attracted to contribute towards their social protection. So the proposal includes things like having access to credit, or also having access to controlled withdrawal of benefits. So this is where my actually presentation ends.
Thank you very much, Stanfield. Why don't you, and also Amson, you can click on your camera. If you could try to respond to Una's question, do we have a way to translate these points so that they resonate with the business community? What do you think? Who wants to go first?
I can go first. Yes, I think we can translate recommendations that can resonate with the business community. As you know, or if you are not aware, we have a United Nations Global Compact, which is basically a partnership between the United Nations and CEOs of about 10,000 companies around the world. And the idea is to make sure that we do create public-private partnerships to address the 20th agenda and how to implement it. So the recommendations that we suggest, or through the reports of the Secretary General or through any other bodies, basically, I think we do work with the private sector. We engage them in meetings and as well as at the country level to seek solutions to all these issues. Definitely, when you're talking of issues like wage policies, you definitely need to talk with the private sector. You cannot ignore them. So I think, yes, definitely there are ways and there are platforms that have been established to make sure that we translate the recommendations into something that makes or that resonates with our business leaders.
Stanfield, do you want to react to this question? What do we say to the business community, ministries of finance and so on, to make them interested?
Well, I think for contributory social protection, I think strongly that the private sector have a role to play, because there are studies that have been done which show that productivity tends to increase when the workers, they know that their social protection needs have been taken care of, when they know that at the end of their journey, in terms of 12 duty, there will be a pension for them. So I think that could be an entry point that we could use to ensure that the private sector takes a keen interest in social protection, especially on the side of the contributory social protection. So even when we're talking about capacity building, we do think that they can help to maybe fund or support some of the activities in terms of capacity building for social protection. For instance, actuarial studies for social protection activities, social pensions.
Thanks. Maybe I'll add a little bit here. Of course, for the whole business community, the purchasing power of the clients, of the customers, is critically important, and social protection obviously can increase the aggregate demand in the economy, which is good for the business community. Also, social protection functions as an automatic stabilizer in times of distress. The aggregate demand won't drop so drastically. Also, I think the social cohesion argument may be less dissatisfied. People there will be less crime. Maybe there will be more trust in the government and willingness among citizens to accept reforms which may be necessary in the society. And lastly, the human development argument that social protection promotes social mobility. It helps the society and the economy to tap into the creative talents of all the members of the society. There is also a question about the social protection floor's recommendation, and it says that it's a significant document, but because of its legal character, it does not prescribe binding obligations for ILO member states. We need a comprehensive social protection convention. I'm not sure if that's a question or maybe kind of a closing statement for this webinar, but Amson, probably you are in a position to maybe briefly tell us what can the Commission on Social Development achieve in terms of, is there going to be a resolution, something that will guide governments in the development of social protection policies in the future?
Thanks a lot. I think, as you know, I think this year the ILO will be celebrating, is it the 100th year of social protection? So I'm sure this is an issue they will pick up in Geneva. But I think during the Commission, definitely there will be a resolution that member states will adopt regarding the priority theme. So there will be elements on social protection issues. But of course, as you know, resolutions in the Commission are not binding, but they are there to set the normative basis for what we think is appropriate. So definitely there will be language that strongly recommends or suggests or urges countries to implement social protection measures and systems and programs.
So thank you to all participants and all speakers. I think we have a historical opportunity here now. The strong community, global community of gender experts and gender advocates is now together with the global community of social policy, social protection experts and advocates. Here in Finland, we very strongly believe that good social policies are one of the best ways to promote gender equality. Also, there is a book by a famous Finnish researcher, Anneli Antonen, which says that welfare society is women's best friend. So it's going to be very interesting to see how these ideas develop through the process from the UN Commission on Social Development to the UN Commission on the Status of Women. Let's follow up this process. Let's participate in it. Some of you and several of you may be members of the national delegations. Let's link up. There will be a similar side event face-to-face in New York during the Commission for Social Development and other side events that we engage with partners during the Commission on Status of Women. So it was a very good beginning. Thank you so much. We have to close now. Bye-bye.
Okay, thank you.
Thank you so much, Timo, Amson.
Thanks to you, Stanfield, Timo, and everybody.